Dr. Shawn C. Roll is an associate professor at the University of Southern California's Chan Division of Occupational Science and Occupational Therapy, where he also directs the PhD in Occupational Science program. Dr. Roll is a licensed occupational therapist, registered sonographer, and an occupational scientist who studies the relationship between musculoskeletal conditions of the arms and hands, people's ability to perform activities, and their health outcomes within the workplace. His specialties include using ultrasound to study carpal tunnel syndrome, which affects an estimated 10 million Americans with an annual healthcare cost of $2 billion, funded by the National Institute for Occupational Safety and Health. He also studies holistic approaches for improving the experience and results of hand therapy. His largest current project, funded by the National Science Foundation, is designing the next generation of intelligent smart desks that can automatically learn from, adapt to, and respond to users' habits and preferences to improve worker health and well-being. Dr. Roll's title of his talk is Enhancing Worker Health Through Multi-Level Transdisciplinary Research. Welcome, Dr. Roll, and thanks for being with us tonight.
Great, thank you. I'm going to share a little bit today here about my research, and when I was asked to give this talk, kind of what I went through in my process was really kind of the question that I get a lot is how do all the different components and things that I do fit together into one cohesive research approach. So in giving this talk for Research Excellence Symposium, I really hope to kind of share the multi-level approach that I take and how I use an occupational therapy and occupational science lens through transdisciplinary research to really advance our understanding and support worker health and well-being. So in doing my research, what kind of connects all these things together then is this understanding of occupational performance and how it contributes to health and well-being within this work context. Particularly as an occupational therapist and knowing the use of occupation and how it can support health and well-being, improving connectedness, those sorts of things, as well as using occupations as a means for advancing recovery from injury or illness. In fact, in my clinical kind of work in work rehabilitation with work conditioning, work hardening programs, I've been able to demonstrate that using occupational tasks within that rehabilitation can increase the odds of successfully returning to work by 6.5 times. So there is something to this, but in my research, I'm just as interested in the components of how occupation and occupational performance contributes in a more negative way, or the contributions towards stress, injury, declining mental well-being, and those sorts of things, particularly with workers in the workplace. So this is what I kind of pulled together from my research and kind of thinking about the individual worker, how they behave, what they do in their workplace, what their workplace environment looks like, how those things contribute to disorders, injuries, stress, and our general well-being. And not only that, but then how those things actually can contribute to or deter us from successfully preventing those injuries or rehabilitating individuals so that they can have more productive, successful, independent lives. So my work in my lab, the musculoskeletal sonography and occupational performance lab, really employs a holistic approach to examine these interrelationships across occupational performance, individual health, and overall well-being. There's two kind of primary areas of interest and targets here, that being worker well-being within these built or physical environments, the organizational and social context within which we work, as well as understanding how we evaluate, prevent, and rehabilitate individuals with musculoskeletal disorders in total. So I take this approach of looking at occupational performance, understanding activities, occupations, participation, whatever the things are that we're doing in our work lives, and understanding then from an individual perspective, what is the structure and function? of the tissues and the different muscles and nerves and things within our body. Using sonographic imaging is my primary tool and mechanism for doing so. And on the other side, then understanding health and health outcomes, patient-reported types of things that we have. And so looking at these interconnections, how do we understand these things in order to actually advance our prevention and treatment of work-related injuries, illnesses, well-being, those sorts of things. For my students and those that know me well, I like to talk in metaphors all the time and use metaphors to explain my work and different things. So the metaphor here today and what I use often to describe my work is thinking about pots on the stove. My career started and I always think about, the one pot on the stove, working with that pot on the stove to, get it to boil, maintaining that pot at boiling and monitoring it to make sure that it doesn't overflow, that we don't have any problems, using different tools and techniques to keep it from doing so. And thankfully, to this point, I haven't had any problems where those pots have actually caught on fire or there's been any issues. At this point in my career now, I talk about the fact that it's not just that one pot, but it's multiple pots. I'm really working toward, a more complex meal and lots of different things kind of stewing and boiling and simmering all at the same time and trying to manage all those different things towards one goal. So today I want to share just a little bit about two of the pots that you heard in the introduction as well, that are kind of the core areas of my current research. First being carpal tunnel syndrome and understanding kind of this relationship of occupational performance to carpal tunnel syndrome and how it relates to these other components of structure, function, and health. So as I mentioned, I use sonographic imaging to look at structure and function. Here is just a demonstration of some of the things that we look at, and hopefully you'll be able to see my cursor on the screen. In the top row of images here, what you're seeing is we can place a sonographic imaging transducer in a cross-sectional plane across the wrist, and we get this cross-sectional image. We can then, in this image, identify the median nerve. The median nerve is what is impacted when we have carpal tunnel syndrome, numbness, tingling, things in the hand. So we can take this image of the median nerve, trace around it, and measure essentially the area, the cross-sectional area of that nerve. You can see this is a healthy nerve. Anywhere between 6 and 10 millimeters squared in its cross-sectional area tends to be typical. When we turn the transducer in the long plane or look longitudinally at the same structure, you can actually see this dark kind of band in the image here by these arrows, which is the median nerve itself now in its length. And you can see again, it's nice and uniform in its shape across. In individuals who have some symptoms, some problems, maybe diagnostic with carpal tunnel, we actually see the size of this nerve enlarged. In this example, you can see a very severe case where we're almost 3 times the size of the normal case. And when we look at the longitudinal plane, you actually can see the small size of the nerve on either end, and then this enlargement in the middle through where the carpal tunnel would be. In fact, when we looked in a study of individuals with different levels of symptoms and severities of carpal tunnel and measured that cross-sectional area, you can see compared to our control group that didn't have any symptoms, the individuals that were considered normal with the nerve conduction all the way out to physiologically having some very severe cases or problems, the size and shape of that nerve dramatically increasing. The question that we have then is, how do we get from this small to large nerve, and maybe what does the contribution of occupational performance have to this? At the outset of my career, I was lucky enough to be involved in a project that was looking at this exact thing, where we had a group of subjects, monkeys, that were trained to reach through a cage, bend their wrist, and squeeze a device to receive a treat. They were then set to work 5 days a week, 8 hours a day. And over time, they developed signs, symptoms, and diagnostic principles of carpal tunnel syndrome based on nerve conduction. We added the imaging, and you can see across a group of subjects that the dark blue line here does demonstrate that there was a beginning increase in size of that nerve across time. And that's compared to these other lines that represent the nerve as measured in the forearm and as measured on the hand or the arm that wasn't working at all. So we were able to demonstrate that there was this relationship in our animal model, which led to the question of, how might this actually develop in the human? And so is this a linear relationship across time? Is there a delayed kind of response or an early response? What does this relationship actually look like? And can we measure that and understand it so that then we may be able to better prevent problems for individuals who are somewhere along this trajectory? So this kind of, I was able to pull together what I consider to be a transdisciplinary team of lots of different experts and landed in the realm of dental hygiene to look at this problem and to work on this. Together, we've been looking at, across the last 5 years, just finished a study with about 120 dental hygiene students and about 50 OT students that were used as control participants, where we've been looking at the differences and the development of things across time. You can see here our dental hygiene students as an example of looking at how they're performing their tasks. We recorded, we have about 150 videos that are 2 to 3 hours in length, all measured simultaneously from 3 different camera perspectives, where we're looking at not only how is the student using their dental scaling instruments, what is going on with the hand and differences across students, but then generally even more so, how are they actually engaging in their workspace? What's their posture, their performance, all of those things. So we can get a full picture of what's going on with these students. You can see we're looking at this full posture. Here's some early data. We have about half of the videos completed. This is about 76 of the videos from 2 different programs. For those that aren't familiar with the Rapid Upper Limb Assessment, it's a quick screening tool that's used to identify potential risk based upon postures. The higher the score, particularly the 5, the 6, the 7 range, indicates that you're working in a posture that may be putting you at significant risk for long-term injury due to your posture. So you can see there's a little difference between the 2 programs. We're starting to identify, how do these things relate to reports of pain and symptoms across the 2 years that we've actually measured these participants. You can also see that we're looking at other things about how they're performing in their work. The images at the bottom show you what's called clock position, which represents where they're sitting as they're completing the dental scaling relative to the patient's mouth, whether it's the 8, 9, 10 o'clock position, which tends to be the primary position at this program, and a little more into the 10, 11, 12 o'clock position in the other program. Simultaneously, again, we're looking at relative specifically to the hand and what's going on there. We've looked at our videos and we've been able to identify 3 types of scaling that actually is occurring with the hand. For those that have been to the dentist, which I presume is most of us, if not all, you know that as you're at the dentist or with a dental hygienist, you may perceive different types of scaling where there's light, kind of quick, even strokes, some more moderate, more intentioned strokes, and then heavy scaling where it's deep kind of strokes that require more force and pressure. Also now, there's a lot of practices that are using ultrasonic scaling that now avoids that actual pressure with the hand itself. So this represents just one participant, just to give you a demonstration of what we're looking at and being able to see how long they're doing each type of scaling, what wrist posture or position is most prevalent or common during the scaling, whether they're flexed or extended. And we're putting that into the revised strain index then to look at over time across different visits, within and across visits, what the actual exposure may be for the different students. Our goal then is to take this information and look at how it relates backward to the structure and function, forward, and those sorts of things. Things that we're considering and looking at. As an example here, this is my hand. I've circled the carpal tunnel as well as the median nerve when my hand's at rest, and merely holding a scaling instrument. And for those that may know dentistry, this isn't the appropriate way to hold the instrument. I'm not doing a good modeling here, but in any case, just with that pinching, you can see how my nerve is being kind of compressed and entrapped. And so the question is, individuals who exhibit this sort of thing, are they at higher risk given the performance, particularly if they're doing heavier scaling activities? We have seen in some early investigation of comparing our dental hygiene students to occupational therapy students, just mere reports of outcomes. of incidence of hand pain fairly significantly in those dental hygiene students as compared to our control group of OT students. So we're trying to take this information now and go all the way across. Is there a way that we can understand and identify people potentially who have some sort of structure function that may predispose them to more injuries or illnesses based upon the performance that could help us explain why some people develop carpal tunnel and others don't? Some of the things we're using that are a little unique are some dynamic imaging techniques. In the video here on the left, you can actually see a video of somebody as they're opening and closing their hand, the median nerve here in the carpal tunnel, kind of hanging out, not really being impacted too broadly by the structures in the carpal tunnel versus the person on the right, that as they open and close their hand, we have tendons and other muscles that sit in the carpal tunnel that you can see are contributing to compression and movement and all kinds of things with that nerve. And is there a difference then in how these people are experiencing symptoms across time? And this has implications not only for prevention of these individuals, can we then alter their performance, minimize gripping, but also into clinical practice for individuals who may have carpal tunnel syndrome. Is there a way we can create a particular type of orthosis or supportive device independent to the individual that would reduce the compression in them that would look different than someone else? We're also using this technique in exploring dynamic imaging as a biofeedback mechanism for other types of conditions as a way to improve individual engagement in the hand therapy process and encourage movement and motion. So we're using this in a lot of different ways as we move forward. And really our goal then with all of this data, and hopefully in the next year or two, we'll have finalized all of our analysis from this longitudinal study across our 180 participants and really have some robust information. Other things then that I'm considering and looking at across my research are overlaying then the environment, the physical environment, the social environment, and organizational environment, which leads me into the other work that's active going on right now in the transdisciplinary team in this work of engineering, psychology, computer science, architecture, where we're really looking at an office workspace and how we can use technology, particularly artificial intelligence, to address various perspectives of worker health, energy, conservation in the workplace, from a psychology perspective, understanding human technology interactions, and really moving forward to kind of develop something brand new. So this really I see as more than just interdisciplinary, but true transdisciplinary work, where we're developing something completely new based upon all of our expertise. Just a little bit about kind of my expertise and my interests, of course, in kind of how we're engaging in the workspace, our posture, what are indicators of stress, and how can we actually help to support worker behavior. We've done a preliminary kind of steps of this with 20 individuals, recording them for an hour at a workspace. We're working with the computer science perspective to then develop algorithms that can identify where the joints are. From there, we can overlay the segments of the body and use some segmenting to identify the segments and blend those two things then together to actually identify specifically where the joint is, where the planes of the body are, and estimate angles. This may look somewhat familiar. The Kinect camera can do some of this, but our algorithms are actually combining this a little more robustly than just looking at planes of the body. And we begin looking, we've tested 1,600 different image captures across this, and we've run Rula scores on these, as well as then automated our algorithms. And you can see that we're doing fairly well with our algorithms at being greater than 75% of the time being able to accurately identify shoulder and elbow positioning that may be at risk. Much better than just using general kind of joint capture techniques in itself. We're moving forward next and looking at the more complex joints of the neck and the trunk. These involve, of course, 3 planes of motion and movement that are simultaneously happening. So it's a little more complex that we're now working on algorithms to look at that. Simultaneously, I mentioned that we're also interested in the environment. So we're measuring things like lighting, temperature, sound, humidity, other things in the environment. We've developed a user interface that the user at the workplace can then provide feedback to the system as to how comfortable they are, whether they want a device on or off, those sorts of things. And we're using that information all to train algorithms and test algorithms that can try to automatically adjust the environment so that it's more comfortable, more supportive for the work, whatever may be going on. In some focus groups that we've run, office workers are excited about this in general, seem to be, thinking that this would be something that would be really useful, but there are considerations and concerns that have arisen, particularly related to this device not changing things or communicating in a way that would be interruptive. And so really we've come down to having to understand and teach a computer how to know when somebody is really deeply engaged in their activities. When should I not interrupt somebody? When are they doing something that is shouldn't be kind of interrupted so that they can continue their workflow. So we've taken our videos now and we're also looking observationally at the behaviors, what people are doing. We've been able to identify some patterns across different participants in they're relatively sedentary, they're moving a little bit, engaging in and out, or they're kind of engaging in various things and moving about. We're now coding the activities that they're actually doing to see if we can come up with some inputs into our AI system that would tell the computer, hey, this person may be in a deep state of flow, or they're really engaged in their work. Probably not a good time to, really interrupt them, or maybe a good time to provide them with some additional supports in the environment to help make sure they're working well. We're looking hopefully in the future at other behavioral things that would indicate stress and those sorts of things that we can continue to move this into the workplace. So we're very excited about that work. I have lots of other things, lots of other pots going on also. My interest in worker health, working collaboratively with a lot of my colleagues and exploring ways that we can come together to really build a collaborative or a center for worker health that embeds some of these future ideas, technologies, and things to support work. So we're working on some of those things more broadly. I'm engaged directly in the sonography community and looking at this as well and developing a registry where we can actually monitor and understand different components that go all the way from the individual worker through the organizational environment and policies that are impacting work injuries and how we might be able to support the profession. Using the imaging and clinical practice, I mentioned the biofeedback work, but we're also looking from a musculoskeletal perspective at other things like flexor tendon repair and looking at the sutures and looking to see when is somebody healed well enough that we can actually begin active therapies and be productive. Some other work I've been contributing to looking in scleroderma and measuring dermal thickness more as an outcome measure with the imaging. So different ways of using the imaging to help us advance the rehab. And finally, the use of mind-body techniques, not only the biofeedback with imaging, but also mindfulness as an adjunct to therapy to help with engagement and adherence, and in other aspects with work. I'm very interested in how mindfulness or mindful kind of programming can help us moderate our behaviors in the workplace and kind of support improved wellness and reduction of injuries. So I'm very grateful to be giving this presentation and to be joining the Academy of Research. And I wouldn't be where I am today, of course, without the folks that have trained me in the past and what I now consider as all my sous chefs and everything that's going on in my lab to really create some exciting things. So I'm forever grateful to the mentors and those that have given me support along the way, particularly Dr. Case Smith, Dr. Evans, and Dr. Baker for their direct mentoring and support, and others who have provided, the encouragement and supports to be successful. And of course, the robust amount of students and other folks that have helped to support the work directly in my lab. Again, grateful to all of them. And grateful to the Academy of Research and AOTF for this honor. Here's my contact information, information for my lab, where you can find us. Then I would welcome any further contact or questions that anybody might have regarding my work. Thank you very much.